I want to start, if I may, by just giving a little update on our plans. This is what we're calling Series 7, Episode 6. We basically divided the OOBs, the over and online briefings, into separate series in order really for us to handle them and to manage them. And so this is the 6th episode in Series 7. And I just wanted to say this is our second to last episode in this series. The next one, which is November the 2nd, will be our last. And that, I think, is a reflection that my own status as Special Envoy of the WHO on COVID-19 does come up for further consideration at the end of the year. And I think it's pretty obvious that the situation has changed rather a lot. That doesn't actually mean that COVID-19 is no longer a threat to human health. And I actually want to focus on that today. What can we expect of COVID-19 in the coming weeks and months? And what would be, in my view at least, the most reasonable way in which people can act, particularly those who are responsible for health policy at local, national and global levels. I'm very pleased to see colleague Catherine Deland is here. I wasn't quite sure whether you were going to be here, Catherine, because I know what else you've got on. Did you want to say anything as we start?
It is always a delight to be here. Happy Friday, everybody. And thanks, David. It's true that my attention is split, and I apologize to everybody in advance for that. Just to mention to everybody that this is being recorded and will go on to FOREST's public website as well as their YouTube channel. So if there's anything that you want to say that you'd like to have us edit out, please just let Mahika or I know. We'll make sure that our email addresses are in the chat. And in the meantime, I just want to re-emphasize David's point that while COVID isn't over, we certainly have entered a sort of new era. And I'm really looking forward to hearing how David is giving us the inspiration and leadership and thoughtfulness, mindfulness, and systems leadership that he always does. So, David, I am super excited.
Okay. Well, we put in the notice that we sent round with an email telling people about the session today. Mahika, who drafted it, put the latest epidemiological information on. Now, several of you are into public health and into epidemiology. So what I want to do, as I've tended to do in previous sessions, is just to start with a short analysis of where I believe we are with the COVID-19 pandemic, and also to look ahead, as I said, into next year. So the current statistics for the global situation, well, we are still seeing quite a large number of cases in each week. There were actually 2.1 million people newly affected with COVID that were recorded during the last week. And we know that that is a massive underestimate. So what this means is that there's still an awful lot of this virus moving around society. Secondly, I want to stress that even though the disease incidence is still relatively high, the numbers of people who are dying as a result of COVID is mercifully small. And that's because the level of immunity against this virus in society, in most societies, is high. That's partly because of past infection, and it's partly because of immunization. Now, when you've been infected or have you been immunized, you're not protected forever. Immunity wears off or fades over time. Now, different people appear to experience this fading immunity at different speeds. And we, at this time, cannot say with clarity who is most likely to retain immunity for a significant amount of time. But the data that is available suggests that older people and people whose immunity is not working well, the immunocompromised, are likely to have fading immunity much, much more rapidly than younger people. And that means that older people are likely to be more susceptible to declining immunity and to reinfection. Reinfection is not trivial. 1 in 20 people who get COVID have prolonged symptoms, and there are people on this call who've been some of the first in the world to call out about the lengthy symptoms, people with symptoms lasting for more than 3 months. There's an additional complication, and that is that there's more and more evidence that people who've had COVID infection have also a raised risk of other health challenges, particularly longer-term damage to blood vessels that supply the heart or supply the brain or supply the lungs. And this longer-term damage to blood vessels seems to be because blood forms little microclots. Clots are most likely to appear when part of the surface of a blood vessel is damaged. You see, when the surface of a blood vessel has a scar on it, the elements in the blood tend to form clots made up of fibrin, of platelets, and indeed of white blood cells. And these, even when they're very small, can block the tiny arteries that are so important for supplying our lungs, our brains, and our hearts. So these tiny clots, otherwise known as microclots, are now seen to be a sequel of infection with COVID-19. It's not the only sequel. And as of now, nobody's quite sure just how important these clots are and how they can be prevented. However, people who seem to be at risk of cardiovascular, that's heart, misfunction, seem also to be those who are likely to get clots. And we have had people on these open online briefings who've been particularly clear about their analysis of how to pick up those who may have cardiovascular dysfunction, particularly dysfunction in what's called the autonomic nervous system. So it's not reasonable for anybody to say that COVID is just a trivial infection. If 1 in 20 people who get this infection have long-term consequences, and if there's also a perceptible risk following COVID of a higher risk of heart disease, of problems in the head, or of breathing challenges, then that means that this is a disease with really quite unpredictable and indeed unknown long-term consequences. And what's particularly interesting in our world right now is we have 2 very different approaches underway. In China, with its population of 1.3 billion, the government policy is to actually do everything possible to stop this virus spreading in populations. Right now, for example, the latest information is that in Guangzhou, which is a major manufacturing hub, millions of people have been asked to stay in their residences and not to move around. That's 5 million people out of 19 million people. have been asked to stay at home because there were 3,000 local infections reported on Wednesday, and government is extremely keen to stop this virus from spreading widely. And that's because the government does not want to see an increased incidence of long-term cardiovascular or cerebral consequences of infection. And yet there are many other parts of the world where surveillance for COVID infection is being scaled back and where government policies are not encouraging people to avoid infection. So much so that there are in several Western European countries official advice. There is official advice by governments that suggests that people need only to isolate when they've been diagnosed with COVID for a very short amount of time. So how extraordinary that there are such radical differences in strategy between Guangzhou and, for example, France or the UK. In Australia, there's an interesting development. There's another surge of COVID cases in Queensland, a 61% increase in incidence, and there's a doubling of hospitalization rates, with people in Queensland being asked to wear masks. But again, I have to stress there is not consistency. So I checked with WHO specialists, what is the advice? And they said, look, we do not believe that this pandemic is finished. We do not even believe that it's reasonable to say that the virus has become endemic. Instead, we have to continue treating this virus as potentially dangerous and treating it as a virus for which there are long-term adverse sequelae in perhaps 1 in 20 people who've had the disease. And that means, everybody, that means that the WHO position is that actually every government needs to have a strategy for dealing with COVID, for responding to surges, for protecting people who are at particularly high risk, and for preventing transmission, especially when the surges are very high in particular areas. WHO believes that governments do need to maintain surveillance to identify variants that perhaps have a different morbidity associated with them, a different kind of illness associated with them, because there are new variants and subvariants emerging all the time, and there's no certainty that each new variant will be milder than the previous one. I'm personally quite concerned that WHO's request for a strategic approach in this situation is not being fully heeded in many countries. And what is the reason? Well, firstly, there are a number of governments who are not quite sure that they've got the support from their populations to continue to take this virus seriously. The backlash experienced in societies, particularly where action on COVID has become part of the political debate between parties, in those situations, it's super hard for public health advice to be given and heeded when it's based on incomplete information and uncertainty. And so, having spoken recently with leaders in a number of countries which are trying to develop a strategic approach, what I'm hearing is them saying to me, we just can't do it right now. We can't engage political leaders in taking the necessary action, and wherefore we are not able to move forward. It's interesting, this is particularly pronounced in high income countries in Western Europe, North America. Recent journeys that I've had in Africa and in South Asia have shown a much greater willingness by governments to continue to take the threat seriously. And I think we've got quite a lot of work to do to understand the political economy here. What is it that makes it so hard for people and their political representatives in high-income democracies to continue to take the threats associated with this virus seriously, to continue to respect the judgments made by public health professionals? It is proving to be challenging, and as far as I'm concerned, it's changing the whole dynamic of public health. You see, in public health, you have to ask everybody to change what they're doing in order to reduce the threats for a subsection of the population. And that's how it's always been in public health. It's proving, as I say, difficult to take that forward in so much of the world right now. Let's just spend a moment or two putting this into a wider context. I've said before in these briefings that in my experience, COVID-19 has revealed inequities and inequalities in society, that the actions that have been taken to reduce the dangers of COVID-19 seem to have had a particularly serious impact on poor people everywhere. And that in some ways, COVID-19 has revealed fragilities in society and even some of the cracks between those who have wealth and those who have so little. So if COVID is revealing inequities, and if COVID perhaps is accentuating these inequities, we must continue to recognize that inaction on COVID now may well have serious adverse implications for poorer people, for people who belong to minorities, for people who are in particular demographic groups. They may well suffer preferentially. And what we're asking is that at all times, public health policymakers should be considering the equity implications of any decisions that are made. Some of you know that I am, in addition to my work on COVID, also working as a member of the UN's Global Crisis Response Group, particularly looking at how food insecurity, energy insecurity, and financial insecurity are coming together and are impacting on people, societies, and nations around the world at this time. In the UN, we've referred to this as the global cost of living crisis. We believe that there are people in 94 countries, totaling somewhere in the region of 1.7 billion, who are exposed to different facets of this global cost of living crisis. We believe that the most extreme consequences are experienced by poorer people. And that means that we will see these consequences, particularly among poorer people in lower income countries and middle income countries. But we're also recognizing that, say, 15% of the population in several Western European countries and 14% of the population in North America is also food insecure, and they are experiencing sequelae of the cost of living crisis. Essentially, if you're poor, you are sliding into greater poverty because of this crisis. It's affecting you because of the higher costs of food, the higher costs of energy, the difficulty with obtaining credit, the challenges of being in debt, and the cutback in many countries in government support in proportion to the level of inflation on prices. Quite simply, poorer people find that the support they get from their governments does not keep pace with the added costs associated with increased living expenses. So how many people are affected? We can't get an accurate estimate, but currently we think tens of millions of households throughout the world, but particularly in the 94 most exposed countries, are sliding into deeper poverty, and it's a continuous process. There's no suggestion to us that it's slowing down. Some aspects seem to be improving. For example, the sharp rise in prices of food commodities that occurred in April, May, June seems to have alleviated. Prices have stabilized, but they're still higher than they were this time last year. And indeed, energy prices in many markets are much higher. So we don't see an end in sight to this cost of living crisis. We don't see a situation where the people who are vulnerable and suffering are going to soon face an easier time. And that's really difficult to communicate. One of the things that has always been hard is communicating about life for groups of people just getting worse year on year. But it's what's happening, because this cost of living crisis follows on from a succession of shocks that have tended to hit the same people wherever they happen. What sort of shocks? Well, COVID-19. I mean, that's been pretty bad. It's led to, at various times in 2020 and 2021, almost half the world's population being invited not to move. I mean, that's a huge thing to happen, especially if you're in the informal economy and you need to roam around in order to try to raise cash to keep your family with food or to be able to access healthcare. And so what we've kind of concluded is that these COVID shocks have then really weakened the fabric of society, particularly for poor people. And they've come around the same time as a massive acceleration in climate-related shocks. At the same time as an increase in the number of places where there's violent conflict. At the same time as we've seen an inflation in prices really accelerated by the effects of the war in Ukraine. And so that's four shocks coming together. And then locally, you get other shocks, for example, like locust invasions and so on. And with that level of shocks, particularly impinging on the lives and livelihoods of poorer people, it becomes a real perturbation to the systems in society through which individuals obtain their food and nutrition, obtain their energy, obtain their healthcare, obtain finance, and more. And that is what's happened. Multiple shocks, disturbing systems. And we don't, at the moment, in the Global Crisis Response Group, see any way in which this situation is going to be getting better in the coming months and years. Even if the war in Ukraine were to stop tomorrow, we think it would still take some time for things to settle down. Basically, the systems on which we depend, on which our current capitalist construction of the economy depends, these systems have been stretched, have been disturbed, and they're just not working, and they're particularly not working for poor people. I think they probably work fine for those who have wealth. But for people who are poor, stuff is just getting more and more difficult. And we get the information about this in this Global Crisis Response Group through the country teams of the United Nations, through the work of the World Bank and the IMF, with whom I was working a lot this week. We get the information through non-governmental groups who participate in networks that we run for the Global Crisis Response Group. And it's so important, as I've said previously, that people like myself are articulate about just how serious this is. At the extreme, there are at least twice the number of people who are really short of food in the world today now compared with a year ago. The total number, depending on estimates, is around 300 million. And out of them, 1 million are in acute, really extreme starvation. There are 6 places in the world which are experiencing famine-like conditions. Some of them are really horrendous. Haiti at the moment, very, very difficult. But there are others as well. In these kinds of situations, it's super hard to contemplate organized action to try to address risks of COVID-19. These are situations where the level of suffering, hunger, starvation even, is as high as we've ever known it. And again, it seems to be getting worse all the time. Just yesterday in Sharm el-Sheikh at COP27, Achim Steiner, the head of the UN Development Programme, said, what we're seeing at the moment in terms of levels of hunger and starvation is absolutely the tip of the iceberg. Looking ahead to 2023, there are at least 50 countries and territories that are at risk of defaulting on their debt obligations. And they're going to find it super hard to get more cash from the World Bank and the IMF in which to provide protection for their people to reduce the likelihood of further deprivation. I mean, it is the most massive crisis, and it is widespread. And it's super difficult in the current political context globally to see ways in which world leaders are going to be able to focus country by country, difficult situation by difficult situation, with national governments and other stakeholders on how to prevent really hundreds of thousands of people from getting into extreme poverty and being at risk of severe illness and death. Never before have we known of a situation that's so hard to communicate. Now, I'm not saying this just because I want to make you miserable, because what I want to do instead is to stress that it's absolutely vital at this time that we are in contact with as many of those decision makers that we still are able to connect with. And we just point out to them that we're aware of just how bad the situation is, particularly for poor countries. And that if you link the cost of living challenges to the challenges of, for example, decarbonizing your economy or helping people to adapt in the face of climate change, as is being discussed in Sharm el-Sheikh, particularly next week, we can quickly see that there's actually an absolute shortage of cash going to poor countries. And that's not only affecting how people react to the cost of living crisis, but it will also affect their ability to adapt as climate changes. So here are we, still focusing on a pandemic, but also increasingly exercised by deteriorations in people's livelihoods, increases in the numbers of people who are acutely malnourished, increases in the numbers of people who are short of energy, increases in the number of people who cannot afford to get healthcare or education. And this is happening as we watch it. It's unraveling an awful lot of the collective effort that's been put in place between 2000 and the present. Again, you can't tell when you're inside it how it's unraveling. What we have to do is constantly be trying to maintain widespread sensory systems to pick up information and intelligence from around the world. And that's why in these discussions, when we have them, I really like it when you can share with me what you're picking up from around the world as we move forward. Thank you very, very much indeed. Several of you have written comments in and we'll pick them up. But I'd like any of you who's got things to say, please let me know. I just want to say, as I look, you know, Florence Egal has been working on these issues with me for a long time. Ad Spiker's the same. Ad's been doing it for years. And then we've got Catherine Atherton, like me, working on it. So many of us are like what one might call seasoned and quite thick-skinned people. We know what we're dealing with. There are some of you who are dealing with COVID very acutely. Frank, I can see you're trying to join, but I don't know whether it's working. You could, as soon as you're connected, tell us, because it'd be very nice to hear from you. And I'm very pleased to see that some of you who are participating in the global campaigns linked to the cost of living crisis are putting comments in the chat, and I'd like to come and encourage you to talk and we will come to it. But let me just come to address some of you individually and see if you'd like to say anything at this time. Frank Atherton, please.
David, apologies, I had the INT remnant, and so I missed the kind of first part of your team. But can I just say something about, you know, where I see public health? I think that's a theme that you've been touching on. I missed the first 10 minutes of what you were saying, but I mean, COVID, you know, it's still on the wane here, and so, you know, things are kind of okay on the COVID. But again, we need to remind people to not want to pay our First Minister in Wales has come out with COVID. He's kind of isolating over the government. But the vaccines are holding the line, and we're getting, you know, some quite good uptake of vaccines. Interestingly, flu, which is on the rise here, we're really struggling to get people to take up flu vaccine for some reason. And we're trying to draw on what we've learned during the pandemic about how behavioural change work, and I'm kind of commissioning some work around that to really understand. It can help with social care workers, David, and not taking up the flu jab in the extent that we would normally expect. But you know, in terms of the kind of broader question of public health, I have to recognise all of these multi-shocks that you're describing, and what I worry about is that because the public bandwidth to kind of deal with all these issues people struggle, I think, to deal with so many complex issues. So getting messages about COVID out at this time is really quite difficult. Also, on the back of that, you know, we're facing, listen to them all day. We've had COVID, we've got the living crisis, the energy crisis. I'm really grateful to you for raising the kind of issue of 6 famines around the world, because I've been using that to remind everybody here in Wales that things are really difficult. There are parts of the world that are really struggling. And adding to that, we've got, you know, population migration, which I don't think you mentioned. And, you know, we've got large number of asylum seekers. We welcome them. We're a nation of sanctuary that want to treat people fairly. But so all of that is conspiring to really make it very difficult to get messages, focused messages around COVID, for example, into the public, and I suspect that's why we're seeing reduced uptake of vaccines, for example. And that worries. And you know, in everything you said, David, you're absolutely right. There are all these problems, but what I worry about with public health is that we're always very good at the analysis, and sometimes we suffer paralysis by analysis. And so the question for all of us, I think, and everybody on this call is a leader in some way, is, you know, what are the solutions? And you know, I go out a lot, I probably go around the NHS here in Wales again, and I hear very gloomy stories. The NHS here is in a precarious position. You know, worse than I've seen it in my time as CMO, and even in my time as medical doctor. But we need to find solutions, and you know, people need to do that. So now is the time, I think, that leadership and all of those people you mentioned, you know, WHO and elsewhere and the UN. I hope, David, that what we're seeing is a sense of optimism, because the leadership is about bringing that sense of optimism. We can't be vacuously optimists. You know, we can't just have no content about it. So we have to be realistic. But that is where leadership needs to be at the moment. We have to try and find solutions. And maybe you're right, country by country, area by area, issue by issue, but these are all interlinked. I'm sorry, David, that was a bit of a ramble, but I mean,
no, but it's good that you've done it. So, I mean, I'm pretty unapologetic. My whole approach on issues around public health is to see an enormous wealth of willingness for collective working among populations everywhere. I have this basic faith in humanity. It doesn't, I think, make me a particularly spiritual person, but I suppose my position is aligned with anybody who believes that humanity is really on earth for a purpose. I don't think it's all random. And so my faith in humanity includes a perception that out of every 1,000 people, there are 999 who want to work together to make the place better for all. And you just see that in the incredible energy in Sharm el-Sheikh. You see it in the same energy at country level on dealing with both disasters, but also structural challenges like deep poverty and deprivation. So that is where I come from. And everything that I have done in my professional life has convinced me you bring a group of people together and you give them a task and you support them in a satisfactory manner and you treat everybody decently, you really do get wonderful, wonderful results. And I've just seen it and I go on seeing it and nothing has stopped that happening. So I'm like you in terms of optimism, but it's not a blind faith. It is a most definite optimism based on experience. But at the same time, I recognize that if in the nature of the structures in which people operate, there's a constant effort to undermine either by really unpleasant and skeptical behavior, for example, in social media, or through just poor leadership where leaders are disrespectful to the people they're responsible for, then things can go badly wrong. But there's no excuse for that kind of behavior. We've known for years that the right way to lead is with respect. The right way to lead is to encourage a clear shared identity. The right way to lead is to share information and not to withhold it. The right way to lead is to seek meaning. The right way to lead is to constantly invest in building trust. And that's what we work for. I think that's what you work for, Frank, having been involved with you and studied your practice over the years. And so I have no hesitation but saying, yes, 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 this is doable. But it does mean that in certain political contexts, we have to accept there's not much we can do if we're dealing with people who want to stand in the way of that sort of stuff. So thank you for sharing that you are optimistic and that you are finding helping groups of people to find solutions. And as I say, I hear time and time again that when you're working at county level and at community level in your own community around your base, that people are saying, yeah, that's what our CMO stands for. He believes in providing support. He believes in helping us to be more effective. Well, let's just hope there are more of people like you doing this, because it is just so important. I see Karen Palmer has sparked and says the optimistic mental model that 99% want to make it better is the only way to sustain our efforts in public health. So right. Gosh, yes. And recently I've been involved in helping younger people who are coming into public health to actually handle this when they are finding what's in the newspapers particularly depressing and undermining them. And it's not a case, Karen, of somebody like me implying that my way of thinking is necessarily better than theirs. It's none of that works anymore. What I'm trying to do all the time, myself and together with many colleagues in the direct organization I work in and beyond, is just simply to be there to accompany good folk as they do stuff, to be by the side of them as they stumble and help them get up, to be there as a mirror if they want to see what others might be thinking about them, or to be as a sounding board in order to react to ideas. And that kind of function that combines accompanying, mirroring, and being a sounding board, I think is the only function for a professional like myself who is committed to getting human systems to work better. Yes, if I was a lab scientist and going to go invent wonderful things in laboratories, then I would work differently, but I'm not. I exist to try to help people be more effective, and that's the kind of work that I do, and I think many people on this call do. And the person I'm going to call on next is a remarkable example of consistent encouragement to others over the years, including to me, Florence Egal.
Thank you very much, David. Maybe I'm not going to come up with a very optimistic statement. I think that we are right now being pretty much paralyzed by the system that has been set up in decades. It's extremely difficult to look at the different dimensions of the crisis with the structure we have in our ministries, in the UN organizations, and the way donors also are parceling out where the money goes. I believe you are quite right. It's at community level, local level, territorial level that actually people can meet, can discuss, have a beer. What can we do? What can you do? What are you doing? And learn from other people facing similar situations and trying not to reinvent the wheel all the time. That would mean it would be fantastic if I had to dream. I would like to have these so-called coalition where we get all the actors from governance, private sector, civil society, etc., fighting together and with each other around the table on what are we going to do pragmatically for this or that particularly vulnerable population group, or for this or that particularly at-risk geographical area. And I think, because you remember we had that conversation the other day and you say, well, you know, there's only so much we can do for reorganizing the UN. And you're right, of course. There's only, you know, how do we get health people accountable to work with food people and food people accountable to work with health people? It's not happening to the extent it should be happening. So I'm sorry to kind of, it's not a pessimistic note. As you know, I will go on and on and on and on and try and do that. And there's so many other people doing it, but it's definitely not institutionalized so far. Thank you.
So, Florence, thank you. Now, Frank works in government. I've worked in government. Many of you work in government. Government organizes itself around spending departments. Those spending departments exist to provide a body of accountability for public finance. That accountability is essential because then the people, the officials who spend the money, report to representatives of the people in parliament through parliamentary committees or whatever. And if stuff is not done properly, then those spenders and the ministers responsible for them are called to account. And those of us who want to work across sectors come up against the lines of accountability very, very quickly. Like you know very well, I've been working on food systems, And food systems means not just teaming up with agriculture, but teaming up with environment, health and nutrition, youth and women, and also labor and other departments in a country. And if you want to try to support a systems-wide approach to food, it becomes super hard if the money that is made available by government is very rapidly pushed down individual spending channels. To then create a collective implementation and accountability system immediately takes one into really awful seesaw battles that occur in governments and in institutions of, do you put the money across the sectors and then have a collective distribution system that more takes the money to a place like a territory and then it is handled there, with all the problems that that brings of quality control and of audit? Or do you keep the money back at the center and run it down the central lines, and then you get better audit and clearer accountability? It's a challenge that's been approached by the government of France, which has tended to have quite decentralized systems, the government of UK, which has been centralizing over the years quite strongly, but has recently been experimenting with different ways of doing it. And so all I want to say is that nobody's got the perfect answer, but I will continue to advocate for interconnected analysis, intersectoral working, multi-stakeholder engagement, and forms of governance that do not get completely paralyzed by the messiness of this kind of collective working, because I think actually the right response to the present situation is to say, let's find ways of working that actually can embrace the mess, rather than try to get rid of the mess because it interferes with cleanliness and tidiness. And as that, the more I look at community organizations traveling far and wide, really, the more I find that in community organizations, mess, uncertainty, lack of clarity, people not fully understanding each other is recognized as inevitable when you're dealing with real life. It's inevitable there'll be tensions and conflicts and disagreements. It's inevitable that there will be polarization of power and efforts made to try to pull it away from different groups of people. And it will always feel not quite right, or even sometimes quite badly wrong. But we still have to work in this mess and get it right. So this is me. I would like to become, if I could rename myself, as Professor of Messy Organizations, or as Organizational Mess. And who knows, that might happen one day. Thank you very much indeed, Florence. What's great about the way you and I work together is that we know that we have the same basic, I think, attitudes and value systems, but we also know that we will not always agree on how best to pursue them. Well, that's good, and that's right, and thank goodness we don't all agree. Let me keep going. Here's some suggestions. Marianne, I'd like you to talk, because it's, I mean, you study this stuff so deeply, and we've worked on it on and off since actually quite a long time, I was going to say, but then I thought that might sound odd. I'd like Sarah Phillips and Holly Wheeler to have a moment. And Holly, I want to say to you straight away, it's special today because you're not in your car and you have got a steady internet communication. But Sarah, I saw just now, I thought you were in your car. I don't know whether you are still. We've also got Claire Rayner and Claire Taylor on, and I would like to come to both of you. Ad Spikers, I'd like to come to you. And I'm going to stop talking because if you could, we just go from one person to the next, and I won't comment. Marianne, please.
Thank you, David. It's not quite, we don't quite go back this far, but I've been doing this for 48 years. but we've worked on different aspects for a very long time.
Brilliantly. Yeah.
It's been a long, hard slog, and I think we're back where we were in some ways.
Yeah.
What I was saying, because I was agreeing with what Florence was saying, but it's the entry points. You've got a system at the global level that is broken. We know it's broken. We know that the trouble starts with the Security Council. That's where there is, and if you can't get past the problems, there's an issue of getting around them. Now, I know when we talk about these serious issues, we all come at it from our own perspectives.
Yeah.
Sometimes our perspectives change. Sometimes I'm pushing the impact it has on women. But what you've got are all these areas that are pulling in different directions, and it's the interlinkages. This is what should have happened through the 2030 agenda. The interlinkages, not looking at your problem from where you are, but what can be a cause of it. And I just give one quick example, because we need new thinking. I work on women's reproductive health and maternal health.
Yeah.
In a remote village in Uganda, what those women want, what's their top priority? Water tanks. Because of the time and the anguish and difficulties in keeping their kids out of school to go and get water. Their second choice is family planning, but they first of all want water tanks. Now we work in health, but we're now trying to get water tanks into that village. But then you got just one comment more. You then realize it's not our job to do that. That is the job of the government. So therefore, with working with these very illiterate women, what we next have to do is to teach them to advocate for what they want with their own government. So it's taking an approach that you should not be perhaps starting where you are. You may be looking for something else and go there to start. Thank you.
Marianne, what you've just described in, I think, really beautiful and quite nice and tight prose is what we're trying to do with the form of working and then leading that we advocate. Because we say in living systems leadership that everybody has a different perspective on the same thing. That perspective can shift even within a conversation, and that's legitimate and okay. But certainly that different people looking at the same situation will have different perspectives, and that's absolutely okay. In fact, it's desirable, because if people start expressing the same perspective when they look at a messy situation, there's a real worry that somebody's got hold of their heads and has brainwashed them. This notion that it's okay to see things differently. It's okay to have different starting and finishing points is where I think you and I do agree. But what I'm trying to say is, instead of it being a rather unusual way of working, can't we make it the norm? Can't we make it so that people, even when they're inside very tight, highly protocol-driven vertical situations, at least know that when you're dealing with complexity, get the perspectives of everybody out on the table and then start working with them. From my experience, it leads to an enormous unleashing of energy when people can say what they think and share it with others. Don't know what you think, Marianne. That's my perspective, though.
I would agree with what you're saying. It's a question of you work on systems.
Yeah.
I just go and find a problem and then see what I can do about it. And we're going to be raising money by having an event in Chiswick in 8 to 8 days time for water tanks.
Yeah, brilliant.
Because we can't rely on our governments.
Yeah.
Now, if you can design a system that gives us entry points, you can look at if you look at the COVID, whatever you call the thing, there are entry points or the bits that stick out. But if you put those inwards And
Yeah,
we all
the
get
spikes on the
into
virus. Yeah, yeah.
Yes, thank you. But if you turn them inwards, then we're all working on the same problem.
Yeah.
And if that is what the 2030 agenda is meant to be doing, but it
Absolutely.
requires a lot of more work on it. Thank you, and I'll be quiet.
Problem in the middle. But I mean, I just love the way you say it. Where it doesn't matter whether I call it systems or you call it problem oriented or whatever. It's basically, it's a way of thinking and working. Now, David, zip and listen. Sarah Phillips, thank you for joining us. Any resonance?
Yes, definitely. Thank you for having me, and it's great to be here. I've moved into a cultural improvement lead role at the ICB Integrated Care Board for looking out into the integrated care system, and really to feed back on. I'm picking up like this. I've only just started, by the way, and obviously I'm excited, but I'm definitely picking up energy. So this stubborn optimist that we know David is, and what have you, and that we all, lots of us are. I'm sort of thinking, am I just imagining this? Because it's you know, it's big, it's huge, there's a massive scope. The NHS is, you know, going through so much, but underneath all that, there's been so much innovation, improvement, and then it's sort of stuck again. So my job is to kind of see what's going on and what's been going through, and then to pull that out. And it's that locally led. It's like music to me. It's all talking about some mechanistic sort of systems approach is still there. Right, here's the answer. Here's this. But we do need those structures. But lots of it's talking of living systems is kind of common now. So I'm out of the NHS, back in after a long time, and there's this kind of common chat. So it's just amazing to hear it, and I feel like.
Oh, I
would
feel
be
like
we're pandemic ready, you know.
Embracing you over Zoom, because it's lovely when you say, I went out and I came back in. It's lovely when you say there has to be some mechanistic and some protocol. Of course they do. There has to be. There has to be accountability. Who sets the dose of the very powerful drug that's going to go in the drip set? Answer, there is one person who's got to be responsible. Otherwise, if you don't have that, as I know from my patient safety work, everything can go completely haywire. Of course, you've got to have that stuff. But what I keep saying is you've got to blend the two together. So both the collective living systems work and the protocol work, because a bit of each makes for a much nicer whole. Let's stay in touch. Thank you, Sarah. So pleased to hear you're back into that. Go on. Yeah. Holly, please.
Oh, it's lovely to see you all. I'm sorry I haven't seen you for a while. And Sarah, we should connect, because there's loads of things that I could share with some of the work that I've been doing recently. I want to say that diversity of thought and perspectives on what's going on in whatever work you're doing is not even nice to have. It's an absolute necessity in order to make the thing that you're working on sustainable. And in the chat, what I was trying to say is that I think the leadership work that we all have is about holding things together that sometimes don't feel easy to hold together. So if I take my example of COVID at the moment, in one of the organisations I'm working with, they're taking a kind of short-term view of, okay, we need to vaccinate as many people as we can, and we need to make sure people are as healthy as possible for the next. That's the immediate kind of response, as well as some practical, like, have we got spaces where people can be socially distant? And they're thinking about it actually both from a really economic point of view around our business sustainability needs our people to be at work, physically in the factories doing work. And they're thinking about it from a well-being point of view. So their long-term interventions are all about, how are our people working? How well are they? How supported do they feel? Have they got spaces to talk about the difficulties? Is there a space for them to go to if anybody's suffering from long COVID or any mental health? So mental health is a big thing for them. So this idea of holding kind of short-term interventions to build a long-term capacity for any system or organisation, I think is a really important part of our leadership work. The other things are about this idea of that you were talking about, David, in terms of exposing the information about what's going on, but also helping people make meaning of it. I think sometimes what's going on is people feel overwhelmed. So seriousness becomes the doom and gloom of a situation rather than the potential and the opportunity for us to be activated, be engaged and connected humans. And that I think is being lost in the narratives, particularly the political narratives are very shocking and serious in a quite negative way. And they don't hold the seriousness in a way that enables us to engage with our humanness and think about how can we do things differently and together, and to explore together. And then I guess the final thing that I wanted to say is that I think sometimes you have to help people find their optimism, and that you have to go to where they are. So in the way that Marianne was talking about, I find the problem that matters locally to people. I think it's the same when we're trying to engage people in anything that matters to us. We need to go and explore where are they at and what matters to them before you can engage them in something that you think matters. That's my 2 pennies, and it's lovely to see you all.
Holly, this is amazing. Can I just, I'm going to go on, so you know, but for an extra 10 minutes. Holly says, we have to be able to hold things together, even when there's tension between them. That is so important. And the skill to be able to hold tensions in a group, they're really, really important skills. We have to make sense of what sometimes appears to be nonsense. Yes. And we have to sometimes be helped to find our optimism. And that means being met where we are rather than being met where the other person thinks we ought to be. Holly, that was just great. Hold those, everybody. Now we go to Claire Rayner, if it's all right, please.
Yeah, hi everybody, it's lovely to see you. Just some random thoughts kind of pulling together on what I've heard today. It is my instinct or intuition, which I think is an underused word, but an intuition that keeps coming back to me over the last 10 years. Community, it's all about rebuilding things at the communities level. And I think that's where we have to go to come out of some of the problems we're in. So it's taking it back into the communities that we are within in the ways that you've discussed. I really do think that. What my things about public health and prevention, I mean, obviously a stitch in time saves 9. I really believe in that phrase as well. I saw my GP and he was just chatting about a lot of different things. And he said, I said, you know, I'm very aware of the workload you've got. And he said, well, we could do without certain things, he said. People want very, very quick fixes. So these days, you know, they would have a sore throat for a few hours and come to us wanting antibiotics. We need to go back to some simple public health community messages on how to manage ill health in its early stages, and you know, obviously longer, but it, you know, he mentioned public health specifically and going back to that messaging within communities. I totally agree with holding all views in a situation. It's obviously a difficult thing to do, but I have found the more of a 360-degree view of a situation that you can get, the better it is. I want to say something very prosaic about the price of a cauliflower, because the £1.65 in my little shop round the corner for a teeny weeny British cauliflower. And in the past, I think, well, past a year ago, would have been about 40p for an enormous one. So that's just an example of something I was quite shocked at with that. Pressures on the NHS. A colleague of ours was last night as a consultant in a very specialist respiratory centre told by the managers, you've got to act as the middle grade doctor as well across the course of this weekend. And that made me think about leadership as well, because instead of a manager sort of saying, right, you've just got to fill 2 people's jobs at the last minute, I think we need to take that step back sometimes and say, right, actually, there are other alternatives than flogging a dead horse. Let's look at what else? Do we need to actually say, right, the unit is closed to further admissions this weekend? Because actually I think the public need to know. So I think those thoughts link into some of the things that have been discussed today. Thank you.
Paediatric services across much of France have shuddered to a halt. And in many cases, they're closing to admissions this weekend. It's a very, very difficult thing for a government to do. Having just seen how much this has led to challenges, all understood. I wanted to say just one other point to in relation. I was talking with the Scottish government, that's showing off a bit, just 2 days ago, on the Scottish effort to try to set up a centre on pandemic preparedness. There was a guy called Stephen Riker, who's a behavioural scientist person, who said, does it really have to be a centre? Can't we think about the kind of scaffolding that's needed in society to encourage more effective cooperation among members of communities so that they are able to build on their own resources? And I'm just thinking, Claire, how important it is, how that links with your first point. There are people saying these things, and they're saying them in quite important places. And I think we should not give up on thinking that that kind of sense of being able to feel through what might work best, that's kind of disappeared. Don't just rely, I have to say this to myself, I'm talking to myself, don't just rely on headlines in British newspapers for setting your a personal political barometer. Remember, politics starts in your own communities, in your own organizations, in your own local parties, etc. Super remarks by you, Claire. Let's go to Claire Taylor.
Hi, everyone. Thanks for a really thought-provoking meeting. I usually sort of rant on about long COVID, but actually thinking about what everyone said today, obviously I can't comment on places like Africa, and I really appreciate the people who are helping there and doing their bit there. I think in every country it comes down to Maslow's hierarchy, and we have countries who are on different parts of the
I'm just going to repeat it. Maslow's hierarchy of needs.
Of need, yeah. And I think not just between countries, but in countries, we have people. So we have our leaders, our current leader in the UK, very top of it, I would say, is one of the richest people in the country. And I grew up in a really deprived area and a really deprived family. And often people don't expect that from doctors. They think we're all went to private schools and whatever. And I can remember in the 80s having an electricity meter, and if you didn't have 50 pence in it, you didn't have any electricity. And some Saturday, Sundays, we didn't have any until Monday morning when we got the family allowance to put the 50 pence in. And that's with parents who are working and working really hard. And I think we might see a narrowing now with the cost of living crisis between what you would call the lower class and the middle class, because talking about, you know, cauliflower is £2, whatever, if your mortgage goes up £400 and you have a set income, suddenly you have to find an extra £400. So I think we're going to see a narrowing where the people who weren't affected in the past possibly will be now, and we already have a housing crisis. And I think where it ties in with things like COVID is that it's not over. I am not overly optimistic at all, because I know that viruses can mutate and do what they like effectively. And if you still have 1 in 30 people with COVID, so I think back in March we had 1 in 30, you know, if you've not got money for your electricity, how have you got money for a lateral flow test? How have you got money for an FFP2 mask? You know, how have you got, you can't miss work because you need to keep the money coming in. And I think that's where leaders and governments have to come in. And I think they did at the start of the pandemic, because there was grants and, you know, people were helped with COVID. And now there's absolutely nothing. not a thing. And I think there was a paper out this week about reinfection, and we're now into the reinfection part of the pandemic.
Yeah.
And the hazard, I mean, it was in the US veteran study. So again, it's sort of older men. It's not representative of the whole age groups. However, the hazard ratio for a hospitalization with recurrent infection was doubled, and vaccine didn't seem to make a difference. Yeah. Many people will tell you that each infection felt worse. And I think we have to be a wee bit careful in every country, but in the NHS, I think we're, like Claire says, we've got units, we've always had units that are on the brink of, oh gosh, we can't manage this weekend, and then somebody steps in and then they manage. But actually, when your standard waiting times for A&E are now 12 hours, when you can't rely on an ambulance for a heart attack, and then you add in COVID, and then COVID reinfections, at some point, it may not work. And I think the British public will find themselves really surprised and shocked at the point that happens, but I wouldn't be surprised. And my 17-year-old said to me today, Mum, I don't know why there hasn't been a civil uprising yet.
No.
And I said, well, yeah, I don't know. And let's hope there isn't that. But I think we've got you're right, we've got a messy situation. And that's just my random sort of thoughts on what's going on at the moment. And I hope as we go into 2023, things are different. But I do think the governments have to take control of the COVID thing. And somebody commented in the chat about should be locked down like China. We don't need to lock down like China. We don't need to do that. We just need to make PCRs available, make money available for people to, if they're at work, to stay home, get that message out. The FFP2 masks are much better than the cloth masks. HEPA filters installed in every hospital, every GP surgery, every school. That's all we need to do. And we're not doing it. And I'll stop now.
Thank you, Claire. Really, really delighted that you were able to not just say what you said, but to say what you said in the way you said it. We are privileged. It was a lovely meeting today. Ad Spikers is a dear, dear friend and has been alongside Florence Egal and me and others, but from a different domain. He's a food and agriculture guy, and we are right deep in this food crisis at the moment. And Ad, would you like to be the last speaker today?
Yeah, very, very briefly, and good to see indeed old colleagues from FAO and yourself, David, as I see you as a troubleshooter on many fronts, and you are the one who connected from the health side, the food side, and you spoke for the World Food Prize in Washington a couple of weeks ago. Mind you, also the Secretary General was in Vietnam, Hanoi, to celebrate 45 years membership of the UN and Vietnam. And when you make up a balance there, we saw that we started out in Vietnam with handing out food, but now the country is able to export food, and the country is also sending peacekeepers to Africa. David, I want to come back to you more in detail, but I can tell you that I finished this week a small piece for a magazine in Wageningen, as I promised to you, Africa from crisis to opportunities. And I would like to share it as a group also. I share very much, David, what you told us in the second part of your briefing, because it's extremely important what's going on. We share some information, what's happening now in Nigeria, what's happening in Congo, what's happening in South Africa. Countries who could really be the motor of changing the face of the world. These countries are in deep trouble. And I would also give as last thoughts of this briefing, but come back maybe in the future more in detail, there are lessons learned. In Asia, we know that things could happen. But David, it depends on people like you, like Florence, like many of us, good people who want to see on the good line to do the best. And if we see these people in power, as we have seen in countries where things were happening, this could, in my view, happening also in Africa. So COVID is a problem. The climate, very good that the world press is on top of it now, this week's. Please try to support that further. That what is very, very, very flattering is this cost of living. That those countries you are speaking about, David, here we have support packages, here we have vaccines, but we know millions of people are deprived and don't have this. So I would share that piece of you, what I did this week. I hope you can print it in your own website.
Yeah.
Please let's go on that these briefings, maybe now COVID is a bit out of the picture, that
Yeah.
the other part of your work is extremely important, and I hope you will continue this type of conversations.
Well, what I like is the fact that people come together and we talk and we share, and we've learned to trust each other over the months, and it means that we actually can have conversations that really do change our way of looking at things. I always get that. Let's just think what Ad said. In his view, Africa is the continent of crisis and opportunity. And we've had the opportunity, in my own case, to listen to African Union commissioners, to Macky Sall, president of Senegal, who's also president of the African Union, but also numerous community organizations. And the sense I get is exactly that. There's so much possibility, so much opportunity. And yes, there are real difficulties because climate change is just eating into African society. 5 successive rain failures across the Horn of Africa, it's not normal. I think that the second thing is Ad talks about Vietnam. I don't know whether you're in Hanoi at the moment or you're in Netherlands, but you have been in Hanoi a lot recently. And when we look at what's happened in Vietnam, at the incredible capacity of people from all walks of life throughout the country to transform their agriculture, to innovate, to develop climate-resistant varieties because of salination in the Mekong Delta, and to establish fabulous ways of getting goods to market, not just within Vietnam, not just within the Mekong region, but much more widely. It is just remarkable. And nobody should, I think, ever write off some of the things that we're seeing from countries that have been able to make the change, whether it's Vietnam in Mekong or Rwanda in Central Africa, Uganda itself. It's really had some fantastic results, and we can go on and on and on identifying examples. So that's our perspective for here in 4SD. That, yeah, if you look around the world and if you have the opportunity to be in different communities, you find amazing ingenuity, amazing generosity, amazing humility, and amazing inventiveness. And that is the set of sparks that will change the world. It may just not be sparks that come from the countries where we've kind of thought they would come from until recently. Just a lot of the new energy might come from different places. And with that, I'd like to thank very, very much Mahika Acharya, Catherine Deland. I'd like to thank each and every one of you for coming along. I'd like to really appreciate you. We will have one more in the current series on the 2nd of December. We will send round invitations to remind people who perhaps not been with us for some time. And then lastly, do think a bit about how we can connect into next year and what format it can take. Would you like it the same? Would you like it to change? We have limited capacity now. We're going through a bit of a hiatus in our organization, so we can't necessarily have the same resources as before, but we don't want to give up. It seems to us to be absolutely critical to the future. And with that, I'd like to greet Polly, I'd like to greet William, 2 family members, and I'd like to thank you all